Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Dr. Craig Wolff of the Bonati Spine Institute. Why is it so many doctors are telling patients that they need to seek out fusion as their way to get beyond whatever condition they suffer with?
In the late 90s, I was a doctor in Tulsa, Oklahoma. I'm an orthopedic surgeon by training, and so I was in a practice that was a spine surgery practice. And all we did was fusions. And then I would say, oh, we need to decompress the nerve. I would tell the patient that. And I'd go to my partners and they'd say, well, you can't decompress the nerve alone. You have to do a fusion. I said, why? I can decompress the nerve. That's really, and he said, because we don't get paid. And the difference between doing a decompression and a fusion to the surgeon was at least $12,000. And that's just one level.
Right.
So there's the answer. Why are we recommending fusion? So when a patient goes to their doctor, the first thing is they can say, you have a bad, let's talk about the neck. You have a bad C5-6 and C6-7 disc. There's a little pressure on your nerve roots, maybe a little pressure on your spinal cord. So we're going to go in the front of your neck and we're going to do a fusion. Throwing in $30,000 worth of hardware.
Ooh.
They never give you can you go in the back of my neck through a little incision and just decompress the nerve and leave my discs alone?
Right.
And there's two reasons. One, they're not going to make money. And number two, they don't know how to do it.
Got
Okay,
it.
so I'm in Tulsa, Oklahoma, and an ad comes up in the newspaper. Alfred Bonati, the world, and at this time, this is the 90s, is going to talk about minimally invasive spine center at a big hotel. So a lawyer friend of mine said, this is really interesting. I said, I don't know what minimally invasive surgery is. He said, please come with me. And I said, sure, I have no problem. Dr. Bonati gave a lecture, and then afterwards, I probably asked a question, and he knew I was a doctor. So afterwards, he came to me and he said, come have lunch with me.
Right.
And I sat down. He's such a nice guy. And he said, you're hurting people. Stop. You're doing fusions, and do you believe in them? And I said, no, I can't say I believe in or not believe in. That's just what we do. He goes, but why? And he goes, because we don't know any other way. And he goes, I will show you another way. And I said, you would show me? And he said, if you come to Florida, I will show you. And after talking even longer, he said, if you come to Florida, you're hired. And you know what? 2 weeks later, I moved to Florida, and Dr. Bonati taught me these things. And the number one principle is, in medicine, do no harm.
Correct.
And fusions are, we could almost say, do no fusions.
Right.
Of course, I came to Florida from Oklahoma, so I didn't have a Florida license. It takes like 3 months to get a license. So Dr. Bonati said, I want you to look up all my patients. You have full access to them. Call them on the phone and find out everything you want. So I put together 5, 6, 7 different studies of all these patients on how they're doing a year after, 2 years, 5 years after. And the results were phenomenal. So much so that Dr. Bonati and I, anytime there was a conference somewhere where this new field of minimally invasive surgery, they of course want Dr. Bonati to speak. And I would give Dr. Bonati, either he would do it or I would do it, a talk about this is what we've been doing. And he was so far ahead of the guys who said they were doing minimally invasive surgery.
Right.
What they were doing is maybe sticking a needle in your disc.
Right.
Dr. Bonati is the first person to use lasers. We use lasers in the disc. And now when you see the doctors out there saying, we're minimally invasive surgeons, we use lasers, Dr. Bonati would tell you now, yeah, we did that. We did the research. It doesn't work.
Right.
And it doesn't work.
Yeah. It turns out that it can be one of many tools, but it is not a magic tool, and it's not the only tool to use. Yes.
When you're a patient, you're going to, if you hurt your neck or your low back, you're going to go in and they're going to say one of two things. If you're a young person, they say you probably have a herniated disc or you have some bulging disc. If you're old, they're going to say you have spinal stenosis and pinched nerves. And maybe some bulging discs.
Right.
And you're a mess. That's what they always tell everybody. You're a mess. You have, let's just say, the neck. You have C4-5, C5-6, and C6-7. So that's 3 of the 7 levels in the neck. What are you going to do, doctor? What can we do? Well, what we're going to do is we're going to go in the front. We're going to take out the disc. We're going to put metal fusion cages in your neck. And then you're going to be fine. Does it matter that you fuse half of a person's neck? Will that change things? And they say, probably not. But if it does, we'll deal with that later. Well, absolutely it does. I would never recommend anyone have a fusion that would be 3 levels. But why? What goes on? So any level you fuse, you're stuck. It can't move anymore.
Correct.
So the other levels got to move more. If you have a 6-cylinder car and 2 cylinders drop, the other 4 cylinders, you're going to kill your engine. Okay.
Right.
So we don't get the movement. So what happens is the people have the fusion, and within a few years, something else goes bad.
Yes.
And what happens is the level that's still moving, either above the fusion, below the fusion, or both, they go bad. What do you mean go bad? Their discs fall apart because they're having to do way too much work than God intended them to do, or nature.
Yeah.
And they develop the arthritis and the stenosis. So then they come to us. Not only do we then fix the level above and below it, but often at the level of the fusion itself, the disc was removed, but the narrowing of the nerves was never addressed.
Yes.
If there's patients with fusions right now, hope is not lost.
Correct.
If you have fusions in your back, and you have, what you will have are rods and pedicle screws. Few things can happen. Those rods are sitting underneath your muscles. Your muscles move. Your back muscles are rubbing on those rods and screws. And of course, what happens? Go ahead, start rubbing your muscle right now hard.
Yeah.
It's going to become irritated and painful. We can take that out and get rid of that muscle pain. That's one thing. There's another thing that can go bad just with the fusion stuff. When you put the screws in, the screws go right next to the nerve.
Yes,
if you're a little bit off, a millimeter one way or the other, you're going to bulge the screw may actually hit the nerve, or over time erode out of the bone into the nerve. And then the answer is not, we should add fusions to the fusion you have. It's, we need to take out what we put in. But that's not being done in the world right now.
Right.
Except what we're doing. At the Bonati Spine Institute. So you may have pain because the muscles are rubbing on the fusion hardware. The hardware itself may be malpositioned or may have become malpositioned, not the surgeon's fault, but with time and decay of your back. And then the thing I mentioned earlier, the level above and the level below the fusion, for sure, as we speak, are going bad and are ready to bring you to another surgery in the future.
Yeah, it's bad news because they mangle and tangle in nerves. Again, they loosen in the bone, and 85% of 3-level fusions fail. And the smidgen that seem like they're going to be successful, those fail in 2 years. So do yourself a favor, listen to Dr. Craig Wolff of the Bonati Spine Institute and avoid it at all costs. Thank you so much for being on the program. If you would like to find out if you're a candidate for the exclusive and patented Bonati spine procedures, visit askbonati.com, and you can see more about what the Bonati Spine Institute offers by checking out our app on all your favorite streaming devices. Thank you for watching.